I am grateful for you here. It's always a pleasure to talk to you. Thanks for coming before the committee. I was excited to review your bill, the caucus's bill, and see that the Section 3, I think you and I had discussions about the $200 million that's in the CLM program. You guys chose a different lever than I would pick. But I'm curious, I don't know if you were in here earlier when I was talking to the Consumer Council, I'm curious about what you think about accountability and metrics for that program, as opposed to moving it from, the utilities purview and moving it, on the general fund budget, which might not even change who administers it, if you have any interest in changing the way we create accountability for that program. And the reason why I ask is, since I've been in this building for 4 years, it is not totally clear to me that the state agencies are always, measuring outcomes the way I would as a scientist choose to measure an outcome. I think a lot of times in government, we measure outputs. So we say number of light bulbs distributed, foot of insulation, and public health will say number of patients saw, but we don't actually measure the outcomes for the patients or the outcomes when it comes to load reduction. And so I'm wondering if you'd be amenable to looking into really creating metrics for that program and every other program that we're spending for. Like for me, I think it's 6 and 1/2 dozen another if it's in the general fund or in the utility bill as a part of the public benefits charge. I think our constituents are going to pay for it anyways. What we really need is accountability for if we're going to have a program, that program is doing exactly what it's supposed to do. And so I'm curious if you think that would get to the same goal, because certainly shifting it, if it's meritorious, doesn't necessarily create the accountability to make sure that the money is well spent and having a good ROI.
I think accountability always has to be the primary aspect. I think you mentioned. With that said, I would argue that moving it onto the state budget inherently would be more accountable than currently the way it is. Because I think if you brought any expert into the room, they'd be hard pressed to even name all the programs that are truly baked into your electric bill. And it's kind of sad, it's really sad, because I have constituents calling me up saying, what is this public benefit charge? That's all it's listed as. And I, as their legislator, can't even detail for them every single thing they're paying for. At least if it was in the confines of a state budget, it would be detailed by the line item. And I think inherently that creates more accountability than anything else. And we could have a real discussion about whether or not it's worth our state taxpayers continuing to fund these things. And I think, Representative Foster, I think even more than that, I think we talk about equity in this building all the time. What is more inequitable than baking the same exact rate on a program for, as I said, a billionaire on the Gold Coast as a working class family anywhere else in the state of Connecticut paying the same exact rate? I mean, if you believe in equity, you believe in transparency, you believe in accountability, then I think inherently we should support the structure and the construct to move this one by one, phase it out of the public benefit, more into the light of the day, more into transparency, and move it onto the state budget. And I think we could even have a better discussion about accountability. Because I don't disagree, to your point, I mean, many of these programs I would admit are probably worthwhile. And the ones that are worthwhile, I think we need to see metrics that are accountable, to your point. You're a scientist, you're a dedicated legislator, you like to see numbers. I want to see numbers too. But let's be honest, our constituents are not getting the numbers they deserve right now and what they're paying that's baked into their rate currently, and it's not fair to them.
I guess what I would argue is that I don't know that there's more transparency in any agency's budget. I mean, we see line item budgets, right? But you don't actually see programmatically what ROI you get when it's a state agency too. So I think we can make that argument that we want accountability and transparency across all of these programs, and I think that's an appropriate conversation we should absolutely be having. I just want to sort of say that I align myself with your comments about the structure of PURA. I have never felt really strong sentiments in whether or not we have PURA under deep or independent when it comes to ratepayer impact. I understand philosophically the idea of it being independent, but I do fundamentally agree with concerns about our ability to have oversight in the structure as it's been proposed, and I do fundamentally agree with the reason and impetus for why we do things should be aligned with the constituents that we serve. Sure. So I appreciate that comment, and I hope that we can all continue to work bipartisanly moving forward in trying to find ways that we can create the best benefit for our ratepayers. And I don't, I think that what we're all grasping at right now is a policy lever, and what lever that we pull that gives the best ratepayer savings. And I certainly don't want to create ratepayer savings and a tax increase simultaneously. And I think I understand what you're trying to say, here. My goal is the accountability, and I'm not sure which way we can get the most accountability, but I understand your philosophy with moving it on budget. So thank you for your testimony and being here today. It's always good to see you.
Ditto.